When a person hears the diagnosis of pancreatic cancer, it is often a death sentence. By the time you receive the news, it is often too late. Do you or a loved one have pancreatic cancer? How do you know whether you did or not? Because it is a silent killer. With further development in treating cancer, many medical opportunities have come about, and with an early diagnosis, it allows people to live longer lives. Pancreatic cancer is a deadly disease that may be preventable and curable. The goal is to make you more aware of what it is, which is what I'll talk about first. Then I'll transition into the risk factors and symptoms of this deadly cancer, and finally I'll talk about the treatment options. First, I would like to take a little time to discuss what pancreatic cancer is and the different types. Pancreatic cancer is malignant cancer cells that forms in the tissues of the pancreas. As a result, there's 3 variations of this deadly cancer. In Identification of Pancreatic Cancer Stem Cells, published in February 2007, Charles Brown stated one type is resectable pancreatic cancer, which is when a tumor is grown in the inside of the pancreas based on information from perioperative staging. The next type is known as locally advanced pancreatic cancer, which is when the cancer is grown outside of the pancreas, surrounding itself in structures like blood vessels. Metastatic is the last type, which is when the tumor has fully spread throughout the whole entire body. All 3 types of pancreatic cancer are similar in diagnosis. That being said, the symptoms and risk factors are all the same throughout. Secondly, I'll describe some of the most common symptoms and the risk factors that come about from them. Obesity, poor diet, diabetes, and genetics could all lead to the development of pancreatic cancer. That being said, a major risk is indeed smoking. Pancreatic endocarcinoma is 2 to 3 times more common in heavy smokers than in non-smokers, according to the National Cancer Institute, referring to the Pancreatic Cancer article. If you fall under any of these categories, make sure to take precaution if one was to notice any symptoms. In Symptoms of Pancreatic Cancer, Ruth Kresh stated, some people experience jaundice, which is yellowing of skin or whites of the eyes, while others face lack of appetite resulting in extreme weight loss. This occurred to my grandfather, who is a strapping 5'8", built like a wrestler. He was loving, caring, and best of all, he was the most strong-hearted person I aspire to be. However, one day the doctor looked at him right in the eyes and told him he had 6 months to live. 6 months to live. My grandpa had a few symptoms, and once discovered, the cancer was quite advanced. The timeline was accurate, and by the time of his death, his physique shrunk, making his appearance look similar to that of a Holocaust victim. Now that I've told you about the risk factors and symptoms of this deadly cancer, I will now talk about the treatment options. Finally, I'll discuss the treatments available for pancreatic cancer patients. In pancreatic cancer, Martin Kaiser stated there are 3 main types of standard treatments used in clinical trials. One treatment is chemotherapy that commonly refers to the treatment of cancer with 1 or more cytotoxic antiaplastic drugs. The type of treatment you receive depends on the type of cancer you have. A 4-drug chemotherapy regimen has produced the longest survival rate ever seen in a phase 3 clinical trial of patients with metastatic pancreatic cancer. Another type of treatment is known as surgery, including different procedures known as the Whipple procedure, total pancreatenectomy, and distal pancreatenectomy. The last treatment is radiation therapy, which is the removing of cancer cells using high-energy X-rays. So there are 2 types, external and internal. External radiation therapy uses machines over the body that sends radiation into the body, while internal uses radioactive substances in wires and needles that gets placed directly into the cancer. In conclusion, according to the article Pancreatic Cancer Statistics, published in June 2012, the editorial board estimated that 53,070 adults will be diagnosed with pancreatic cancer in the year 2015. This type of cancer is often too difficult to diagnose because there is no specific cost-effective screening that can reliably and easily find early-stage cancer in people with no symptoms. Some people do survive this silent killer, however, most do not. This particular cancer may not impact you, but it could have a loved one. Imagine if someone told you that's important to your life, that they only had 6 months to live. How do you feel then?